high school, I had trouble with depression, and they thought I was a moody teenager. I was very irritable, but it turns out that it was depression. I didn't realize that the depression was really the problem, so I felt that where I was living and what I was doing was the problem, so I decided to come out to Wisconsin to go to college because I thought that I could escape this awful feeling that I had. But when I got out here, it only got worse. I came to Rogers with a diagnosis of bipolar disorder, OCD, and generalized anxiety disorder. You know, my therapist did suggest focus first, and we just looked around to see if maybe there was another option or if focus was the best option for me. And we looked thoroughly, and there was only one other program in the country that was similar to focus. And I liked the sound of Rogers better. I thought Rogers had more opportunity for like experiential therapy and art therapy than the other hospital did. It doesn't feel like you're hospitalized. You feel like you're here to get better, not locked up. I really did want to come. I was tired of being sick. I wanted to feel better. And I guess I expected that I wouldn't have to deal with as much stuff as I did. What was really hard, I had things that I had never addressed in my life, and I thought I could get away without ever talking about them, but really they were affecting me very deeply and they had to be discussed. And so that was the hardest thing, but probably the most beneficial. And I guess here I relearned how to take care of myself and how to be something other than sick. I was doing so well in focus. You know, I definitely wasn't well yet, but I was working really hard and I felt like I was making progress. And my insurance company saw that little bit of progress that I had made and said, "She's done. She's fine, she can go home." And that was not true. I was not fine and I was not well. Luckily, my therapist and my psychiatrist applied for a patient care grant for me, and I received 14 days, which is a generous gift. And so I was able, that allowed me to get all the way well. That 2 weeks made a huge difference. And it was the difference between me getting well and me spending more years being hospitalized. I really can't thank donors enough for patient care grants in general, and especially for mine, because it was the difference for me between life and death. And that's a really big thing. And so not only did the patient care grant make a difference for me, it made a difference for my family. And it meant that I could finish my treatment without putting a financial burden on my parents, who obviously couldn't afford to keep me at Rogers without that grant. And you know, donors should just know that they actually are saving lives. My care grant did save my life.